Hi, my name is Christy, RN to BSN APU student, here to give a presentation about sleep disturbance and cancer-related fatigue. So today's objectives are assess vulnerable groups and identify unfamiliar concepts, explain the relationship between fatigue and sleep problems in cancer patients, describe contributing factors and provide implications for better management, and articulate and utilize resources to promote health and maintain wellness in daily living. So, you're tired, you feel wiped out, and can't seem to find an ounce of energy. This isn't the I need to get more sleep feeling you sometimes had before you were diagnosed with cancer. It's a persistent and distressing sense of physical or emotional exhaustion that doesn't match the amount of activity you're doing. It's cancer-related fatigue. Mary Jennifer Markham, MD, FACP, couldn't have said it any better. According to Roscoe and Cabello, fatigue and sleep disturbance are two of the most common side effects experienced by those with cancer. The National Comprehensive Cancer Network defines cancer-related fatigue as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. And cancer-related sleep disturbance is defined as this difficulty falling asleep lasting over 30 minutes or nighttime awakenings that add up over 30 minutes or both. And while the symptoms of fatigue and insomnia may diminish after completing primary cancer therapy, between 20 and 30%, the problem remains constant as much as a year and longer post-treatment. So cancer-related fatigue has been reported by up to 90% of cancer patients in some studies, and in another study or more than 1,600 cancer patients, nearly 60% reported insomnia. Several studies also have shown cancer-related fatigue and sleep disorders are increasingly reported as a part of a cluster of 3 or more interrelated symptoms, such as making pain worse, increasing the chance of depression, affect concentration and other cognitive functions, and make fatigue worse and make immune system weaker. Contributing factors are predisposition for the problem, precipitating factors, treatment and habits formed during treatment, and ongoing medical problems. Some common causes of cancer-related fatigue are chemotherapy, radiation, anemia or low blood count, pain, emotional distress, sleep problems, medication, poor nutrition, or lack of exercise. According to Gavillo, women, adolescent, and young adults are more likely to experience these problems. For women cancer survivors, there are probably a variety of factors, including treatment-related hormonal changes that can cause menopausal symptoms, like hot flashes and night sweats, which can interfere with sleep. In adolescent and young adults, it may have to do with their stage in their life. They're working, going to school, dating. They have so much on their minds that keep them up at night, and then older adults, because older adults are usually in stable relationships and may be retired. Also, demanding social and professional schedules, so it's harder to manage fatigue and sleep disturbances. So American Society of Clinical Oncology and the National Comprehensive Cancer Network has developed screening approaches for sleep and fatigue issues with questions that ask, do you have problems falling asleep or staying asleep? How often does this occur during the week? And what is your current schedule on a typical night? This is asked because most patients will not mention it. Here are a few things to manage fatigue and sleep problems. Try to sleep 7 to 8 hours each night. Avoid caffeine at least 6 to 8 hours before bedtime. Stay active by exercising at least once a day and avoid exercise too late in the evening. Conserve energy. Focus on major tasks first and do things slowly. Eat well, drink plenty of fluids. Take time to relax and reduce stress, like doing deep breathing, meditation, prayer, talking with others, reading, listening to music, painting, or other things you like to do. Most importantly, talk to your doctor or nurse. Let them know how bad your symptoms may be so you can get the help you can deal with. Like this doctor here, yes, you have sleep and fatigue problems, but in the next 3 months it should get better. If it doesn't, come back and tell me, because I can help you. In conclusion, fatigue and sleep problems are distinct conditions, have a strong interrelationship, and usually occur as a part of a multi-system cluster. And even though these are symptoms that are frequent during treatment, these problems can occur much longer for many survivors after treatment is completed. It is important for patients to inform their healthcare providers so that they may provide relief and or determine whether the problem is being caused by a treatable medical condition. So this is the part where we take a post-test, and I hope I was able to cover today's objectives. If you feel you have any questions relating to what was presented today, please don't hesitate to ask. Otherwise, thank you for allowing me to be here today.